So welcome to this session today with myself and Samina. This is a session on acupuncture for pregnancy. We're going to be covering lots of different topics. Hopefully you have questions to ask Samina. I have some questions that have been submitted beforehand as well, which we'll be going through. Just to introduce myself, in case you don't know who I am, my name's Erin. I am a hypnobirthing instructor with Better Birth, and I teach hypnobirthing classes online and in person in and around Bromley and Kent and South East London. I'm a mum of 3. And I've been teaching since the birth of my third baby, my son, a year ago, because the hypnobirthing made such a huge impact on me and my birth that I wanted to empower and share that positivity with other pregnant people. Yeah, it's been really busy, and I've had lots and lots of couples that I've helped all the way through lockdown, particularly because lockdown's been so difficult and COVID has been so difficult for a lot of birthing people. You need more support now than ever, and I feel very blessed and very grateful to be able to help so many couples, particularly at the minute. So that's just a little bit about me. I'll hand over to Samina to introduce herself.
Lovely, thanks Erin. Hi everyone. So yeah, my name is Samina and I'm an acupuncturist. I'm Samina. Hi, sorry, not quite sure what happened there. So sorry, I'll start again. My name is Samina and I'm an acupuncturist and naturopath, and I run a clinic in Brockley, South East London, so I cover a lot of the South East London area, and I've been practicing now for 4.5, coming to 5 years. I mostly specialise in women's health. So women's health as a term is quite broad, but that generally covers all sorts of endocrine disorders, gynecological disorders, things like infertility, menstrual irregularities, all the way through to pregnancy and care post-pregnancy, postpartum. I also focus on areas such as stress and anxiety, and also areas such as pain, chronic pain. Obviously, stress and anxiety is quite a big thing at the moment, and I often find that is a big part of the work I do in women's health as well, covering all these different aspects. So a lot of these things are very interlinked, and I think I find that the concerns that women come to see me for are so varied that no day is ever the same. Each person is very individual with what they present. So I get a lot of satisfaction of being able to help women, especially if they're having, struggling to conceive or having problems with their pregnancy. It's really wonderful to be able to be part of that journey with them. During lockdown, it's been interesting as well. Like Erin said, being able to support people during this process has been kind of really fulfilling. And I found whilst we weren't able to work, I had a lot of my patients kind of coming towards me, wondering what they could do during lockdown to support themselves, and very eager to come back and start again with treatments. I had a number of pregnant clients as well who were, some got pregnant during lockdown, and once they've been, trying for a while, or had their pregnancies were continuing. So they were touching base with me throughout the whole process and started to come and see me once lockdown was lifted. So, I see, as I said, quite a variety of people, and especially with pregnancy, you get a lot of clients coming on board who maybe are coming to see me towards the end of their pregnancy, wanting some support with things like stress and anxiety, pain leading up to, or, the idea of pain leading up to the birth, and also things like labour inductions and breech births. So it's quite a varied scope of ailments that acupuncture can support with. So yeah, that's probably rambled a little bit, but it's a little bit about myself and what I'm up to.
Thank you, Samina. I think before I open it up to questions from anybody, would you mind just explaining a little bit about what acupuncture is?
Of
For
course.
anybody that doesn't understand.
Yeah, no, absolutely. So acupuncture is it's a pillar of traditional Chinese medicine, and traditional Chinese medicine originates from China and is almost 3,000 years old. It's one of the most oldest and tried and tested forms of holistic medicine that are out there. And acupuncture is based on the idea of the body has 12 meridians. They're essentially energetic pathways, and these energetic pathways have hold our vital energy and our vital reserves. When we get ill or when there's an imbalance in the system, it's often a result of blockages within these pathways. Acupuncture needles attempts to get inserted into these various different channels at various certain points in order to unblock these pathways that are causing various different imbalances in order to restore essentially homeostasis in the body again. I've got my little, I'll just show you, you might be able to see, I've got my little guy, sorry, excuse this, but you can kind of just see the pathways that run all the way down, and they run on the back as well. So, you know, it covers the whole system. And the beauty of acupuncture is that it treats patients and clients as individuals. So I could have two pregnant women who come to see me, for instance, exactly the same kind of in terms of where they are in their pregnancy, same concerns. They may be both stressed, but the root of that stress could be coming from different places. So I would treat that person as how they present to me and their symptoms, rather than almost like a pill that often when you have things like headaches and stuff, you just take a pill because everyone's headache's the same, and Chinese medicine doesn't view it like that. We consider the physical and the emotional part of our symptom presentation to be very intertwined. It's, you know, one will always impact the other. So acupuncture aims to rebalances all of these symptoms so that you get a general sense of well-being, as well as a change in the symptoms that you're actually trying to seek help for.
Okay, thank you. That's really interesting. Does anybody have a question that they wanted to ask Samina? You can either put it in instant chat or... Yeah, you go ahead, you can type. That's fine. So Shriti's got a question for
Lovely, you. No problem.
So her question is about nutrition and how acupuncture can help. Her baby has SGA. Well, I'm not sure what SGA is. Oh, small gestational age.
Yes.
Okay. So your baby's small for its gestational age.
Yeah, so within acupuncture as well, Chinese medicine deeply looks at nutrition at the same time. It looks at the energetics of food. So what would happen is that if you were going to go and see an acupuncturist for support, they would look to use points that, first of all, in terms of the actual points itself, things that are going to boost kind of the energy towards the growth of the the baby in the uterus, as well as boosting blood flow to help support growth and cellular change. We're looking at working with a patient who presents, I don't know, just as an example, if I had a patient.
Oh, Samina, I think the internet's frozen. One sec.
Oh,
there we go.
Are you back?
Sorry, the internet connection went a bit dodgy. Apologies.
All right. So sorry, I was saying as an example of someone who comes in and they present themselves as very cold, you know, And that's quite common actually in women, where you'll get someone who goes, I just can't ever feel warm enough, like my hands and feet are always really freezing, I always just feel cold to the bone, it's very difficult to warm up. In Chinese medicine, we view that as cold has penetrated the system, so you need to warm the internal radiator up. You won't do that by eating foods that are cold in nature, energetic, so things like green raw smoothies or raw foods are very cold in nature. What that person would need in order to kind of get the circulation moving again and blood flow moving again is warm foods, because warm foods are energetically moving, they're energetically circulating, and they really do help get everything moving again. So when a patient comes to see me, especially if they're pregnant, not only am I looking at the fact of where they are in their pregnancy and actually the symptoms that they're presenting, but I'm looking at the constitution of that patient. And when I decide how that patient manifests itself, you know, so it could be quite cold, could be quite hot, lots of different ways, I would tailor a program of Chinese nutritional therapy in order to help counteract those issues that that patient's having. And by doing that and creating again balance in the body, normally you start to see a little bit of change and shifts in terms of a small gestational age that of the fetus that's developing. So that's how nutrition tends to work with patients. That again, that's the beauty of it. It's so individual. It's not the same. The way, you know, I would treat you would be different I would treat to somebody else. So it's really beautiful, and that fact it's so holistic, so it works like that. Does that help?
Shruti says, is it just via the foods or actual acupuncture?
Acupuncture as well, yeah, acupuncture as well. So I have quite a few different modalities that I use in treatments that come under the umbrella of acupuncture and Chinese medicine. So dietary advice obviously is one of them. We also use a method, I think you mentioned about before, Erin, called Moxibustion. So Moxibustion is a form of heat therapy using the herb mugwort. And mugwort actually has infrared cellular energetic qualities, which means it can penetrate much deeper into a cellular level in the body compared to standard heat therapy like a hot water bottle or a heat lamp. And because it can create this cellular change, it almost kickstarts the energy system again in order to kind of reboot itself and start moving. So again, using the example of cold in the system, using something like Moxibustion is going to be really good to bring warmth really like from a kind of deeper level back into the system. We also use thermal heat lamps as well, which also provides a deeper level of penetration with heat. We also have bodywork therapies known as cupping and gua sha, but we use those very carefully and very reservedly with pregnancy because they're quite moving techniques. So if anything's too moving, you know, there's always going to be a small risk of something just unsettling. So we generally stay away from those therapies when a patient's pregnant. But acupuncture, Moxibustion, heat lamp therapy and dietary support would be the main kind of 4 areas that we would focus treatment on when somebody would come to see me.
Okay. Carla, did you have a question?
You're welcome.
You can either unmute yourself or you can type it into the chat. I'm going to ask a question in the meantime, just while Carla might be typing. You mentioned the Moxibustion, and I posted about the Moxibustion on Instagram because I had a client who had a breech baby. And she was desperate to get baby to turn because she didn't want to. Obviously, when you have a breech baby is when baby is presenting bum first or feet first, and ideally you want baby head first when they're born. You have various different options when you have a breech baby, but quite commonly women will opt to have a elective cesarean rather than give birth to a breech baby. Although you can give birth to a breech baby vaginally. and she was desperate not to have a C-section. So she wanted to get baby to turn. And one of the options for breech, obviously, is using Moxibustion. Would you mind just talking a little bit through how that works?
How that works.
It's kind of mind-blowing because it has a really, really high success rate.
Yeah,
so it really, really does work. And I'm really interested to know how using Moxibustion can get baby to turn.
So as we were talking about, Moxibustion can reach this kind of the inner workings of the body on a much deeper level, much cellular level, and the changes that can occur are far more significant. With Moxibustion for breech, we use, it's just a singular point on the corner of the toe on either side. And when we do that, that particular acupuncture point is known to help trigger hormonal changes, which relax the muscles within the uterus, allowing to give a bit of extra room. And it also creates a bit more of a kind of an increase in energy in that area. And that can often help the baby become a little bit more active. A lot of women do present that when they've been having breech treatment for a few days, they can actually feel like the baby's just getting a little bit more kind of like, almost like they're a little bit more excited. So it increases the activity of the baby and encourages it to turn. It's a really relaxing, Moxibustion is very relaxing. Most people who have come to see me in clinic, for whatever reasons, when they have it, they find it really grounding. Just the smell is just, incredibly grounding and very relaxing. So that combined as well, I think it really just helps the mother kind of zone into the treatment a little bit and almost focus their intentions a little bit to the idea of the baby actually turning. But predominantly it's the hormonal change that will trigger that softening and that relaxing and giving more room that will allow the baby to turn.
Okay.
It's even more successful when you do have the manipulation. It's ECV, isn't it?
Yeah.
And I've, research I've done over the years has shown that, actually the two as well can actually make, if you do end up still having to have that, if you've had at least 5 days worth of Moxibustion therapy on that point, it does make the ECV a lot easier and less kind of traumatic on the mother as well. So it's incredibly powerful. It's amazing.
That's really interesting because external cephalic version is where they manually turn the baby to try and get baby to encourage baby head down, and that's, I think normally that's got a 50% success rate, so it's 50-50 whether it will work or not. But I didn't necessarily think about using the two together, but actually it makes sense that it would make the ECV more successful.
What's good to note is that what often might happen, and it doesn't say that it isn't as successful, but a lot of women may come and present themselves to an acupuncturist kind of a lot closer to the due date. And that's often in a way of like hoping that the baby might eventually turn on its own. You can have success with that, but what you find is that at that point, there isn't much room left for baby to turn at that point on its own. So we often recommend that actually, when you are, once you discover the baby is breech, around about 34, 35 weeks, the chances of the baby turning, if you start Moxibustion therapy then, are far greater than if you leave it to like 38, 39 weeks when it just, it can happen, but it might not have such a degree of success if you come in about 34, 35 weeks.
Okay. Carla's asked if she's using an acupuncturist already, but it's her first time. How does she know if it's working?
It's so. It depends on obviously the reasons you've come to see them. Someone who maybe comes in for general well-being or maybe a little bit of anxiety, they will normally present if they've experienced acupuncture before and they're fairly comfortable with the procedure itself. Normally, once the needles are in, people feel straight away very, very relaxed. They almost, sometimes, a lot of people just fall asleep on the table. And that is the body's, is triggering the release of neurotransmitters. So when we insert needles into the acupuncture points, they're located very often to nerval pathways which connect to the brain. When we insert a point, we send a signal to the brain to essentially kickstart or change a system that needs regulating. So, for example, in the example of anxiety, if someone's coming to see me for anxiety, from a medical point of view, it's the HPA axis that is under a bit of stress. That's the parasympathetic and the sympathetic nervous system. But acupuncture can send signals to those different axes that regulate our nervous response and the release of things like adrenaline and cortisol, which are stress hormones, and can enable it to kind of turn back into a parasympathetic state. So if your body is in fight or flight, essentially, when you're feeling anxious and you want to switch it back, and acupuncture can do that. So you will generally always feel fairly relaxed straight away. Some people report things like better sleep straight away. You can sometimes, when you're actually having the needles themselves, you might find that you can feel sometimes a tingling sensation at the certain points where the needles are, or you might have a needle on the side of your foot, but you'll be feeling warmth elsewhere in the body. This is all signs that we've tapped into the right channels and the right points, and we're trying to provoke a change in the body. Again, depending on what someone presents with, will depend on whether you see a change in their symptoms straight away, or whether it might take a few weeks to kind of resolve itself. And every patient responds a little bit differently. And, you know, first treatment that you have with an acupuncturist, we normally try and gauge and get a sensibility of that patient, whether they are maybe more sensitive or are what we call deficient, which is like maybe there's a lot of fatigue and, you know, just tiredness and they're feeling quite withdrawn, or someone who is full of energy. Their response will always change a little bit. So the hope with someone who has fatigue is that over a few treatments, they will start to feel a little bit more energized. You know, they can keep going a little bit longer. Maybe they don't have their afternoon slumps that they normally might have. Or someone who's full of bees and, you know, maybe is a little bit too energetic, can generally feel like they can step back a little bit and be a bit more calmer, be more kind of taking things a little bit more in their stride. So the presentation is also different for the patient, but normally starting points that people will find and relaxation that you'll start to do.
That's really interesting, especially when you're talking about using the acupuncture for things like anxiety, because in hypnobirthing I talk extensively about our parasympathetic and sympathetic nervous systems. And the reason being that when you're pregnant, and particularly when you go into labour, being in that freeze, fight or flight state and secreting adrenaline can stall the progression of labour. And you actually want to be in that calm state, so oxytocin is flowing. So yes, it's interesting, really, really interesting.
No, it's not too late. I have clients who can see me fully aware of what's happening, and that the wife knows what's happening as well. Normally I would discuss any contraindications before you come in. before you actually come in, just to ensure it's the right treatment to proceed with. So at this point, 31 weeks is absolutely fine, depending on also, you know, if what symptoms you're experiencing at this stage. I hope that helps.
Sorry, my internet is absolutely shocking today. I don't know what's going on. I've had to come downstairs. Don't worry. I've been kicked out of my own Zoom twice now.
I started answering a question. I hope that helped the answer, but if you have anything else, so I just was relaying.
Does anybody else have any other questions? Just while we're waiting for anybody to ask another question. Oh, how much does a session typically cost?
So they vary from each acupuncturist is, you know, they set their charges according to things like area and just the specialities. For me personally, I charge for my first appointment is normally £70, and that's because you have quite a detailed consultation at first, which normally takes about half an hour, and then the treatment itself is normally about 45 minutes to an hour. So that's my charge for a first appointment, and then the second appointments are a little bit shorter and they're 60. It varies quite a lot within the area. Say for broccoli itself, there are a few people who charge a little bit less. There are a few people who charge a little bit more. So I'm fairly in the middle, but there are variations. If there is an issue or if there's a concern in terms of expenses and money, there are also community clinics. So community clinics, they differ from private practice in the sense that treatment is not given in a one-to-one setting. It's given a setting almost like a hospital ward. So you have a few beds in an open room. I mean, at the moment, it's a little bit more secure with, I think a lot of them have got like screens in between the bed. But in that way, you don't have a private session. So there are other patients who can sometimes hear the consultation that's happening, and you are in a room with obviously other people receiving treatment. But that's quite a cost-effective way to have acupuncture. And some people actually really enjoy the community spirit, I suppose, of having other people in the same room receiving treatment. And so that's another way. And there are a few community clinics in South London. There's one in Telegraph Hill, obviously in this area. And there's one, there's one in Sydenham, and there's one in Camberwell. So there's a few around if private sessions are a little bit more cost prohibitive for people.
I've got another question to ask. So you've mentioned breech, obviously, yeah. But what other sort of common pregnancy symptoms or ailments or whatever you want to call it,
that come up,
kind of treat throughout pregnancy?
So fatigue is a big one, a lot of stress and fatigue. And another really common one is morning sickness as well. That's probably one of the most common ones that people do come to see me for. Stress and anxiety, especially in the first trimester. Obviously, because that's a period where things are still kind of developing and we're waiting for the 3-month scan. So there's a lot of, understandably, a lot of stress and anxiety that comes from that. And as a result, people don't sleep very well. And I think that first trimester is when a lot of the energy levels seem to plummet with a lot of pregnant women, whereas obviously second trimester tends to be a bit easier. So that tends to be one of the more common ones of ailments coming to see me. What also can happen occasionally is when patients present with threatened miscarriage. So the way it works with acupuncture is that obviously if someone suspects they're having a miscarriage, obviously the first port of call is to go and visit your midwife and your GP without a doubt. But that is the point where they'll obviously be checking whether there is still fetal viability, and obviously if the cervix is still closed. If the cervix is still closed and the fetus does appear viable, then acupuncture can actually help to try and stabilize the instability essentially that's happening within the uterus. It can't guarantee any changes at all, but it can certainly help support, and it can help again with the anxiety, which is really important. I mean, obviously, I think often what happens when people are in that position and they think it's okay, they often send the patient home to just kind of rest. That's often me. I think it's just rest up and wait and see. But that is a good time to actually start getting some acupuncture in order to try and help keep the energy maintained within the uterus. From a Chinese medicine point of view, miscarriage is obviously having a downward effect with the energy flow. It can't hold itself. So we use points. Sometimes we use moxa in order for the energy to remain raised and kept up, which is really important with miscarriage. Sometimes we can get quite good results, and people do go on to kind of have a full-term pregnancy. Sometimes it's unfortunately the way that it wasn't meant to be, and it's an inevitable miscarriage that happens. It isn't the most common thing that comes into clinic, but it does appear sometimes. And I would say with some of my clients who I've worked with from a fertility point of view, they've continued to see me afterwards as well. And if it's happened once, I've had a case quite recently where unfortunately it didn't go beyond 6-7 weeks, unfortunately for them. And it wasn't going to essentially survive, but we worked together in order to kind of help her come to terms with what was happening with her body at the time. So, she'd obviously been on a very long journey, having conceived and been, having infertility issues. So, when you're faced with that, acupuncture can just provide a lot of support and comfort, even if it can't actually change the inevitable outcome of something, as devastating as that.
How about things like obviously as baby grows and gets bigger, all of your ligaments start stretching, and a lot of women suffer with things like SPD and pelvic pain. Can acupuncture help with things like that?
Yeah, absolutely. One of the main things that acupuncture is known for, especially in the Western world and Western medicine, is its use in musculoskeletal pain. And again, even though we're not trying to change the position of the baby at that point, or it's still growing at this stage, so you don't want to interfere too much, but what you want to do is try and reduce some of the inflammation that's building up in the ligaments and joints, and restore blood flow to that area in order for them to just relax a little bit. And often that comes about with regulating certain hormonal changes as well that are happening at the same time, so it can be incredibly beneficial at that stage. Especially, I had someone quite recently who was presenting a lot of pubic bone pain as well. And we did a few sessions, and I think it'd gone from about 80% up to about 30 or 40%. So it was enough for her to go, I can manage this now. This is good. Yeah.
And how about induction? Because obviously that's another quite common thing. You've got breech, and then you've got women start stressing about being induced and having
of course.
And, I imagine that acupuncture is probably another fantastic option to help gently nudge things along.
Definitely. What's really interesting about labour induction is that it uses there's a number of points that when a patient is pregnant, normally we stay away from, simply because they have an effect of a downward action, like I was telling you before about miscarriage. So these are points that are contraindicated in pregnancy. We don't use them at all. We use them a lot in helping women get pregnant. So then if the patient does get pregnant, we avoid them. And then when it comes to around the time where they're thinking about actually they've reached their due date, they don't want the induction, those points are brought back into the mix again, because actually that's what we want to create, is that downward action for the body to kind of start to, for the cervix to soften and the muscles to relax a little bit, and essentially start stimulating uterine contractions. And it can be very effective. Sometimes it can be one session, sometimes you need a couple in order to get going. The two that I've done maybe in the past few weeks, I saw one patient, I think it was like a Wednesday, and she thought she just wants to just see what happens, and she went into labor I think 3 days later, and her induction was due I think the Monday, so it was well before it was planned. And then I had another patient who we did 2 sessions in 3 days, and her induction was booked on a Monday and she went into labor Sunday night. So it can be very, very effective. It sometimes might not always work, and there could be other factors at play that are contributing to that, but it generally can be very successful. What I would always say to my patients is that if they are thinking ahead, that they want to ensure that they don't go into labor, that labor induction isn't a treatment that you can have like at kind of 36, 37 weeks. It has to be at the point of, your due date or beyond. And the purpose being that you want to avoid, where possible, a medical induction. If you want the body to almost start to relax a little bit and soften a little bit and get itself prepared, both physically and mentally, then we look at doing different points, starting about 36 weeks in order to prepare the body for labor. But again, none of those downward action points would be used at that point. It would be much later on, once we're past the due date.
Shriti's asked how many sessions before you would see any impact?
In a specific condition, or?
She hasn't said, but I'm guessing for induction.
So again, it can be pain, for example, pain. Normally you would see a shift within the first session. It's very rare for someone to kind of leave the table and go for a week without having feel like the pain has reduced in some level or form. But in order to kind of get pain levels really, really low, you'll normally need probably about 2 to 3 sessions. But again, each patient is a little bit different and individual. I've had patients who the pain has just disappeared completely and it's only come back once, a few weeks after that. And actually the severity was much less. So that can often be a way of how pain presents itself, is that, it could still be there, but the level of discomfort has reduced. And so it does vary, but I would say between 1 to 3 sessions is probably a good example.
Okay. Does that answer your question, Shriti?
Great.
No problem. We've mentioned fertility.
Yeah.
So how does acupuncture help with conception?
So acupuncture is the way it essentially works is that it's about hormone regulation ultimately. So acupuncture research has shown that, again, it can directly influence the HPA and HPO axes, which are part of the nervous and the endocrine system, which helps hormone regulation. And by its effect on those actual axes, we can actually influence hormone regulation. So it can support things like where people sometimes have raised FSH levels, or estrogen levels are quite high or quite low. It can all help with regulating those hormones, which obviously we know is really important for a healthy conception. By the regulation of hormones, we start to see changes in menstrual cycles as well. So it's very common for a lot of my clients to come and will spend a lot of time discussing their menstrual cycle. And I ask a lot of detail. Some people think like, do you really need to know that? But everything from colour, pain levels, the type of pain that you have, what time in your period you have it, whether you have ovulation pain, whether it's, do you have any clots when you start your period? All of this information paints a big picture for me of where the imbalances are lying within the menstrual cycle itself. And when you start any fertility treatment, I'm looking to try and regulate that. And it's very interesting how a lot of people will come in and think that their cycle's fairly normal. So they could go, it's 28 days. but actually I have severe pain that knocks me out for 2 days, but that's normal, right? And it's like, no, it isn't normal. Pain is a sign that something's not right. So we need to be looking at that and addressing that and trying to regulate that. So these kind of changes can then ultimately have a lot of effect on certain gynecological and endocrine systems. So things like that affect fertility. So things like hypothyroidism, polycystic ovaries, endometriosis, just, you know, a number of kind of disorders like that. We can often see quite a big change in that and improvements in that. Cycles get like shorter, less heavy, more healthy color of blood, less painful. And these are really, you know, people, I think we suffer. We think all of this is normal, and we tend to just kind of go, okay, this is just part of the monthly cycle and I just have to accept it. And actually that's not the case at all. We don't have to accept it. So when I work with women who are experiencing fertility issues and their cycles are problematic, when you start to see that change and that shift, even if they haven't got pregnant yet, but when you see it, it's like, it's a really beautiful light bulb moment where they feel just like, why was I just suffering with this for so long? Or just being fed, you know, very strong painkillers by the GP as a way of suppressing the pain that I was experiencing. We can't always reverse conditions, but we can certainly make it more manageable. And ultimately the goal is to improve the cycle so much that actually it results in a pregnancy and a healthy pregnancy. We also work with boosting the blood flow to the uterus, which is also really important. A lot of problems sometimes with fertility patients is that they can conceive, but actually that it doesn't implant for very long. You know, within a couple of weeks it's gone. So you start to work on things like progesterone levels, you know, the level of lining that's in the uterus, is there healthy blood flow to the uterus? We're just ensuring that there's all this, you know, keeping the uterus and the environment as healthy as possible, and that is good energy flow, nourished, fortified blood flow to the area. Things like endometriosis, for example, is an example of a disease where blood kind of stagnates a little bit. So people really describe these awful period pains, you know, huge, heavy bleeds, massive clots, you know, of blood clumped together. We want to be working on that and removing that really clotty blood to allow a smoother flow. And when we can get a smoother flow, we normally kind of see changes in people's fertility prospects.
It's really interesting, isn't it? It's got so many different uses, and it's interesting. I mean, you mentioning about all the painkillers and things. You were mentioning before we actually started the session about acupuncture and becoming a bit more mainstream. Do you want to talk a little bit about that? Because I just think
it's so what's happened recently. So as I said, pain was probably the main thing that's the Western society and the Western medical healthcare system associated acupuncture with, because, you know, the idea is that you insert needles close to tight bands of fascia and connective tissue, and by manipulation of that you can get normally a release of pain. What's actually happening there again is that we're triggering the release of neurotransmitters such as endorphins, which is almost like part of our happy hormones, and they can actually help with pain. What's happened now is that the National Institute of Clinical Health and Care Excellence, which it looks after the healthcare systems in the UK and the different elements that it covers, has actually changed its guidelines so that suggesting that GPs should now be recommending acupuncture over opioid painkillers for chronic pain, which is a massive breakthrough, because obviously as acupuncturists we've known these benefits for a very, very long time, but for them to actually be acknowledged by such a big authority such as NICE is pretty great, because the amount of painkillers that it's not even the UK society, it's a global thing. You know, we are addicted to painkillers as a society, and the problem with that is that painkillers ultimately will put an extra burden on the body. You tend to have additional side effects sometimes depending on the strength of painkillers. I've so many people I know who have maybe been prescribed things like cocodamol will complain of like constipation or feeling really, really out of it. So you kind of almost like trying to solve one problem, but you start creating another. It's like a cascade. And obviously with acupuncture, you don't have any of those side effects at all. And actually you are creating shifts and changes in pain that painkillers are ultimately, they might help at the time, but ultimately they're just masking the problem. Acupuncture is trying to get into the root of the problem. It's like, but why are you having this pain? You know, you've got a headache, we can take paracetamol, it's a quick and easy fix, but actually why is that headache occurring? And that's what acupuncture looks to try and find out. We're like detectives, I think. Always literally, you know, as I said, we ask so many questions in order to understand the nature of pain. Why is it different? You know, your experience of pain will be so different to somebody else's, but you might both present themselves with headaches to me, but I will treat you both very, very differently because of that. And that's why I think acupuncture has got such a, what's the word? It's such a, it's got a momentous role to play, I think, in the consumption of painkillers in the UK and changing that around. And I think this change of guidelines, which I think is coming into effect later on this year, could be a little bit wrong, but I think it's going to make wonders for a lot of people, especially if they already are taking lots of painkillers and drugs for other problems. So there's less burden on the system for them if they can avoid it. So I think it's great.
And it's just fantastic that it's tapping into the body's own natural reserves and natural systems. Like one of the things that I teach in my my classes is, because obviously we talk a lot about hormones, because they have such a huge role to play in pregnancy and labour, and when you're building up your stores of hormones and you're building up that oxytocin, and it cascades the release of other hormones. And one of them is endorphins. And your endorphins are 500 times more effective in terms of pain relief than any opioid pain relief that you can get in the hospital, which I think is mind-blowing,
isn't it?
When I first read it, I actually had to go and Google it and check, because I didn't believe that actually that you could be that your own endorphins could be that powerful. I think there's obviously it's a bigger conversation about, you know, I think how we've all become so reliant on them and feel, you know, that is the only way forward. And I think this just opens it up much bigger. It opens it up a lot more to those people who have maybe been on the fence, not too sure, or you know, considered acupuncture a bit wackery in the past. You know, I think it really solidifies its position as a, you know, an important part of medicine and healthcare throughout the world. You know, acupuncture is in many societies is used as, it's got equal footing in Western medical care. You know, I'm a big fan of Western medical care. You know, it has a valid and important part to play in our world, in our society. You know, if you needed emergency medicine, you go to the hospital, you go to seek these specialists and these people out. But for day-to-day concerns, if we can actually prevent people from having to go to that extreme length to get the help they need, and actually find ways of being able to support them and avoid that kind of scenario, it's I think it's really powerful and really important that can happen. I think it's fantastic. Carla's asked, is acupuncture painful?
Is it painful? I would say predominantly no, and I'm not going to kind of lie. Some people are a little bit more sensitive. For the most part, it's painless. What will happen is that when the needle gets inserted, people generally feel like they're aware that something's gone in, but it's very kind of like split second of a sensation. Then what they might feel is a slight dull ache or something that feels a bit tingly. That's a sign that we've connected into the right energetic point and we've connected to the channel. So that normally is the main sensation people will feel straight away. Sometimes people don't feel anything at all. And actually, I find those people quite interesting, because actually they require the needles to be stimulated a little bit more in order for them to get that what we call the chi connection with that point. But acupuncture needles, I don't know if you've ever seen them before. I don't actually have any here with me. They're almost like the size of a strand of hair. That's how thin they are. So a lot of people just do not feel them being inserted in at all. Some people may feel a little bit, but any sensation that you do feel is momentary. And it's completely different to, say, if you're having an injection or blood test, where actually, I had blood tests very recently, and I kind of went, I winced a little bit, because it's just like I had to look away, because I use needles every day, but I still just like no, and it's a completely different sensation. I'm quite often at home just needling myself, watching TV, putting a few points in, which is quite funny. But so that's generally the kind of sensations that you would expect to feel when you have a session.
Carla's also asked, how do you stimulate the needles?
So once the needle is in position, essentially. So for example, I just wonder if I can show you on my hand. So there's an acupuncture point here, for example. I will initially tap it in, so it kind of penetrates the skin surface. And then I push the needle slightly further down into the correct depth. Depth changes according to where the point is on the body. When I've reached the correct depth, the stimulation will involve me kind of almost rotating the needle in either an inward motion, so something like that, if you see how my fingers are going, or I'll be going the other way like that. And the difference between those is depending on what action I'm wanting that point to achieve. So, for example, if someone presented with me, they've come in, they're exhausted, they're quite fatigued, their energy reserves are very, very low. In Chinese medicine, that's what we call deficiency. So there's a weakness, there's something lacking there. So what we want to do is build that person up. If I was to do the action of kind of slowly inwards, my intention is that I'm trying to reinforce the energetic principle of that point. I'm trying to tonify, I'm trying to nourish, I'm trying to build that person up. If someone presents to me with a pounding headache that's throbbing, it feels like it's bursting out of their sides, that's what we call a kind of syndrome of excess. It's like it's very full, it's not, it's very pounding in nature. So what I want to do is try to reduce that. So when I'm doing this, going kind of like that, I'm actually pulling the needle a bit more aggressively, a bit more out, rather than slowly inwards. It's a bit hard to show, and I hope it's making a little bit of sense on the screen, but kind of going out, that kind of stimulation is to reduce something that's really excessive pain, strong pain. But someone who is just weak and just tired and just like they as I said, they need building up, so the actions are much more gentle and reinforcing. So that's generally how you would stimulate. Sometimes you do a technique that's kind of somewhere in the middle, and that's again based on the presentation that a client comes in with and how I use that. Does that help?
Does anybody else have any other questions before we wrap up? I'll just wait to see if anyone else wants to type anything. Oh, Shruti says, how does she book a session?
Well, obviously, depending on who you wanted to book it with, the main port of call, and a good port of call, is to visit the British Acupuncture Council website. That's the main regulatory body in the UK for acupuncturists. There are a few others as well, but that's the main one. And that means that the acupuncturist has gone through a degree level training. So that's often 3 years. Either through a diploma or an actual degree, but it's always degree level. It means that we've had thousands upon thousands of hours of training and clinical experience. So that would definitely be the first port of call. Then depending on what the concerns are, obviously with something like fertility, there's a group of people called the Acupuncture Fertility Network, and those acupuncturists have had extra additional training in things like gynecology, obstetrics, all of that, and it just shows an advanced level of knowledge into that area. So if you're looking for something specific, the Acupuncture Fertility Network is a good one to go to. But if you're looking for a general acupuncturist in the area, but you want to ensure they've got a good level of knowledge and grounding, then the British Acupuncture Council is the place to go, where you can literally type in a postcode of your area and it comes up with everyone who's listed in the area. Then it's a case of kind of going through and seeing which acupuncturist, you know, resonates with you ultimately. People have different preferences of the kind of people that they're looking for in therapy. So it's often a case of kind of like researching them and seeing what their specialities are. Most acupuncturists will talk about their specialities on their website. So yeah, that's a general one. If you wanted to book in with me, then you can kind of just head to my website, which is saminahaider.com, if you wanted to get in touch. So if that's the case, feel free to send me a message.
I'll drop everybody an email with your details.
Yeah, that's great. That's great.
Just to make sure that everyone's got your details.
Perfect. That's wonderful. Thank you.
Thank you so much, Samina, for today.
Oh no, you're very welcome.
Really
I hope it's been useful for everyone. And you know, if sometimes questions come up afterwards as well. So on my website, my email address is there. So even if you just have a few questions that, or you know, something you wanted to just discuss in private, please feel free to email me, and I'll do my best to come back to you as quick as I can with an answer. Hope that helps.
Thank you so much.
No, you're welcome. You're welcome. Thanks, everyone.
Thanks. Bye.
Bye. Bye.
Oh, they're gone.
Oh.
Thank you. I'm so sorry.
Okay.
My internet is so bad at the minute. I don't know. I don't. This is the first session where my internet has played up so much.
Oh, really?
Yeah, it's been really bad today. I don't know why. I think my husband's going to have to complain about it. But
I haven't actually done any streaming in the work. Like, so I'm in the clinic at the moment, and I was just thinking, please let the internet work. Like, it's always